for a father, for an adoptive parent, for a foster parent, in the exact same way that I mentioned earlier, where it's really not all about hormones. It's about the intensity of the life change. It's about the social supports. It's about what it is to do early newborn care. It's about do I feel isolated and alone and unsure of myself as a parent, or my own history getting stirred up. All of those things are equally true, whether somebody has physically given birth or not. Um, so I got tripped up because I'm less worried. I was trying to get technical about the terminology, but honestly, I'm less worried about how do things fit in diagnostic categories neatly to what is the experience. And I think the experience can be quite similar, and we're learning more and more about that. So it is really important, as we're offering family level care, to think about the experience of each person in the family. And so the co-parent, whether it's a same-sex relationship or a heterosexual relationship, how is the co-parent doing in their experience of becoming a parent? How is their mental health? I think there's not enough services for moms, but we have more services for moms than we do for dads. And we've got to be thinking about, and a lot of our support systems that are in place are historically pretty woman-centered. So how are we getting fathers involved? How are we also thinking about their experience of becoming a parent and supporting their mental health? And we do know that depression is prevalent for fathers, or, I think it really signifies this transition. So 7 to 10% of fathers experience depression in the postpartum period or after becoming a parent, which is slightly lower, but quite close to the rates that we see for mothers. And rates tend to be higher for dads 3 to 6 months postpartum, so a little later. So the most prevalent period for women postpartum is the first 3 months, where you would start to see symptoms showing up. For dads, I think the fact that it's a little bit delayed talks about that relationship impact. And when we're in a family system, when our partner is stressed or overwhelmed or having mental health issues, then that also triggers, the desire to help, the amount of stress that they're carrying, and then maybe can lead to depression for dad as well. So there is some correlation that's been found in research that when one partner is depressed, it often can sort of impact the other partner and their depression. And the particular issues that fathers tend to talk about is the feeling of powerlessness. So wanting to help, not knowing how to help, wanting to make it better, and how powerless that can feel. And then what that stirs up. Conflict between work-family balance, which I think couples are really navigating in lots of ways. Like, how do we have these new roles, and who does what around the house, and how does it feel equal and balanced is often a real areas of stress, and lack of social support. And I think there's still less supports. And again, I would broaden the lens to any parent who hasn't birthed, whether it's a same-sex co-parent, an adoptive parent, a father. At the workplace, when somebody watches somebody go through pregnancy, it's like they start to adjust expectations, hopefully, and have some room in the postpartum period or around that adjustment, that like there's going to be a parental leave, but even expectations start to change in the workplace a bit that don't for when we don't have that visual signifier. So I think parents who become parents through co-parenting or adoption aren't necessarily getting the same kinds of social support and social adjustment to give them room to become a parent and have the space and lower some expectations, so that because they're doing newborn care. So there sometimes has to be more conversation about that, or hopefully a supportive supervisor, or somebody who, um, there can be that recognition of support, because it is often the simultaneous pressures that I see parents really struggle with. Like, I'm trying to do so many things and I just can't do it all. Um, so that's just, how do we think about like how that all impacts?